Let's run through some low testosterone symptoms. These are questions I get all the time. Guys throwing symptoms at me and saying, is it low testosterone? We use a questionnaire called the ADAM questionnaire. It goes through all the main testosterone symptoms, and some of them are worth more points than others to give you this presumed diagnosis of low testosterone before we do actual lab testing. The two most important symptoms for a presumed diagnosis of testosterone deficiency can be low libido, so low interest in sex, and erectile issues. Either of those, and you automatically have a positive screening test, and we do some lab tests. These other symptoms are a little less specific, which is why you need a bunch of them to have the same presumed diagnosis of low testosterone before we do the testing. These are going to be decreased energy. Do you have decreased ability to play sports? Are you having an issue with work performance? Are you noticing decreased height? That's through bone density loss is going to cause you to shrink over the years. Do you have a decreased enjoyment of life? Are you sad and or grumpy? The common picture of patients that I see are going to be guys whose libido is waning. They have some erectile issues independent of the libido, so they could be in the mood and still have trouble performing. They're going to be ones who fall asleep on the couch after dinner, or don't even make it to dinner. When it comes to the decreased enjoyment of life, sad and or grumpy, it's not necessarily depression, can't get into bed kind of level of sadness. It's more of just feeling blah all the time. I always say that it seems like the color has drained out of your day-to-day life here. So these are symptoms of low testosterone. If you're noticing that you check a lot of these boxes, it's worth getting checked out by a physician or another medical professional.